I really spent my youth going from museum to museum, and in particular science museums, etc. So I always had that interest, and I think that's really what sparked my interest in science in general, and just biology and helping humans, etc. Plastic surgery deals with patients that are all the way from newborn to centurions that are 100 years old. And even within that, we do work on bones, we do craniofacial work. Most of what I do is somehow related to my area of specialty within plastic surgery, which is microsurgery. But that's really quite broad. So if I look at the breakdown of what my patients are, it's probably somewhere around a little over half that's breast reconstruction. And another, if you break up the remaining patients, believe it or not, it's kind of split between hand surgery and cosmetic surgery. Because it does take this level of super specialization, this really broad group of experts can come together and really give the best care. So when I first see a patient, I think the most important thing for me to really glean from them, by the time they've made it to plastic surgery, it's really sort of a super specialization. It's the most important thing I can do is try and understand what they want, what their goals are, how I can really help them. It's important for them to feel, and I think where we can help, at least in that initial visit, it's important for them to feel like when they're done with all this, they're still going to be whole. They're going to be a whole person, and that the treatment is just the beginning of getting them back to their life.